Tēnā koutou, tēnā koutou, tēnā koutou katoa. He mihi nui ki a koutou katoa. Ko Sue Pullon takou ingoa, no ahurangi aho, ki te whare whananga o Otago ki Ponaki. Pō good afternoon and welcome. It's really great to be able to talk to you all this afternoon, and I'm going to share with you a little bit about the Otago Interprofessional Education Program, which I set up in 2012 and has been running ever since, with Health Workforce New Zealand funding, now the Ministry of Health. And you'll see from that slide that this is a real partnership initiative. University of Otago in Wellington leads this program, but we by no means could run it without a lot of partnerships. Really want to acknowledge Hauora Taurawhiti and Hawke's Bay District Health Board because they have been absolutely wonderful partners, along with EIT, Otago Poly, and a range of other tertiary education providers as the program has grown. So many of you will know, of course, that Taraji is up on the east coast of New Zealand, and it's a long way from the various campuses of the University of Otago. I'm based in Wellington. A lot of the students come from Dunedin, but students come also from Eastern Institute of Technology in Taradale and also in Gisborne. Hei aha te mea nui o te ao. Hei tangata, hei tangata, hei tangata. What is the most important thing in the world? It is the people, the people, the people. And I think that's been our mantra since the day we started for this program, and this lovely stained glass window that's in the Gisborne Public Library really epitomises the journey we've been on, trying to paddle the waka in the same direction. So in a nutshell, the Tairawhiti program invites students to join the program for 5 weeks at a time. We run this program 5 times a year in Tairawhiti. The students are all final year students, so this is very much a transition to practice program, and the students come from a range of places around New Zealand. They live together in shared accommodation that's provided respectively in Wairoa and in Gisborne Hospital campuses. And you can see the range of students that we now have on the program. Not all students can attend every block. There are timetabling constraints, there are real juggles and challenges organising when the students are able to come to Tairawhiti. But when they're there, they spend quite a bit of their time based in clinical work, so they're on clinical placements. As most of you will be familiar, that final year students need work experience and they're working with health professionals in their own discipline. But in this program, we also get them to be working in pairs and in threes, working with students, learning with, from and about each other in different settings. So we might have in a community pharmacy, we might have a pharmacy student for whom that's their normal sort of clinical home, but they will be joined by a nursing student one day, an occupational therapist student the next day, and it's their job to teach the other student what it is that they do. So the students get a really good idea of their own roles, but also the roles and responsibilities of the other health professionals that they work with. There's also an integrated program that's run by our staff up there. We've always been very keen that this program gives something back to the community in the short term, so the students engage in doing community projects which are requested by different health providers and different parts of the community in Tairawhiti. Our current team is Natasha Ashworth, who's a nurse by background, Marty Kennedy, who's a pharmacist, Rose Schross, who's our program coordinator and administrator extraordinaire, and Janie Thomas, who's a midwife. Those 4 people really help to coordinate the integrated program for the students over the 5 weeks that they are there. The range of objectives that the students are expected to meet are quite complex, and as you can see there, range from Haora Māori objectives to interdisciplinary objectives, rural health objectives, and looking at chronic condition management as well. So these all in their own right are important things for all health professional students to learn about, but by bringing them together in an integrated program, this is a very different way of learning for most of them. These are really important objectives in a place like Tairāwhiti. Half the population is Māori, so we couldn't do this without deep engagement with Haora Māori and Tikanga Māori. All the students go on a noho marae when they first arrive, and they're expected to give back to the community and engage with the community as well. All of these objectives we've been able to show that the students have engaged with and learned from. So they learn in many different places. They learn in community pharmacies, they learn in consultation rooms and general practices, they learn in the hospital, they learn out on home visits, they learn when they are driving around the region, going out to visit some of the much smaller places than Gisborne and Wairoa themselves. So since 2013, when the program expanded to Wairoa, we've been able to cater for somewhere between 75 and 80 students a year in total, spread across 11 disciplines at various times. And that's been quite a challenge, and I think we can pretty accurately say now that that's about the capacity of this particular community, because remember, the health workforce is only quite small in a place or places where the population is quite small. So we've had over 500 students through the program now by the end of this year, and we're really proud of that number of students who have engaged with the program. But just to put it in perspective, there's a long way to go if we want every health professional student to engage in this kind of activity. At Otago alone, there is somewhere between 3,600 and 4,000 health science students enrolled at any one time, and if you expand that to think about EIT, SIT, Otago Polytech, AUT, etc., 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 the country has at any one time many thousands of health professional students, and all of them get trained in clinical placements. It's an enormous ask on our health providers and health professionals to undertake that training. So supporting those people to do that training is really key to expansion. We make no apology for sharing with you a little bit about our research in this space. The words evidence-based and the words theory and conceptualisation have come up with the earlier speakers. So we've undertaken research and published about a lot of different aspects of this particular program, and really keen to be able to say to you, yes, we're pretty confident that in the short-term outcomes we can show that the program really makes a difference to many students. But it's not just all about numbers on seats. A lot of this is deeper and more complex learning than it appears on the surface. The social learning, the shared accommodation, seems to be an important feature of this particular program. I think those conversations that you have at the dinner table etc., are pretty important. We've also looked at some of the issues around professional identity that arise on this kind of program. Sometimes people think that interprofessional education is all about producing generic health workers. Well, that is not the case. Interprofessional education is about understanding and articulating the various roles of and the various skills that those roles bring to modern patient care, particularly for people with complex conditions. So some work with the dental students. We've also looked at the combination of perceptions about cultural immersion when students are on an interprofessional program, looking at talking about students who talk about nurses and nursing. Interestingly, in this piece of research, wasn't just the nursing students who were able to more clearly articulate what it means to be a nurse, but many of the other students in other professions got a much better understanding of what nursing was all about. The longitudinal interprofessional study is a study that we've looked at the cohort of students who went through the program in 2015 and also 16. But what we've done here is compared these students with their cohorts from which they were drawn. So for 500 odd students, we've followed them now for 5 years. They literally, as we speak, are just finishing off answering their very last survey. And we've been very excited to be able to say to you, yes, we've got an over 80% response rate over 5 years, and that's no mean feat for a program which follows people over time, especially mobile young health professionals. Quite a lot of these respondents are now living and working overseas, and hopefully coming back to us soon. So we've published the protocol, but we haven't got any results, and we'll have those sometime during next year. One of the things that we very quickly realised with sending students to Tairawhiti was that expecting students to go in cold turkey, if you like, into a different way of learning and a way of learning with other health professional students for the first time as final year students is simply not sufficient and not educationally sound to expect students to go into effectively a capstone project with no prior learning in the field. So we're developing now at Otago a whole range of learning activities which more junior students can undertake on the main campus in Dunedin and which more senior students can undertake successively in various places where students are distributed. So we have a longitudinal curriculum development, we have a conceptual framework and in which the goals are far more than simply undertaking IPE for its own sake. They are very much around producing students who are collaborative ready practitioners, who are socially accountable, who are culturally competent, and who are also understand the principles of leadership and followership. So those are all things which the Tairawhiti program has sparked. 5 years on, we recently went back to some of the very early students who were in our very first 2012 and 2013 cohorts and asked them about what it is they remember about coming to Tairawhiti and what effect it might have had subsequently. There's a whole range of responses. I won't read all of these out. You can read them for yourselves. But just one that struck us very much was it hasn't influenced my career choice, although I haven't forgotten what I learned and the values the people of Tairawhiti hold. So this is gold in terms of educational change and students' appreciation of the privilege that it is to be a health professional and work alongside people recognising and acknowledging their values. And I think that's something that we it's not quite an unintended consequence, but we've been very proud of what the students have gained and articulated. Of course, this doesn't all happen without a big team of people behind the scenes. It's not just about the people on the ground delivering the teaching. It's not just about the students who are actually at Tairawhiti. There's a big team of people who work together across the disciplines, across the institutions, and from head office. I think if you don't support these kind of programs that are a long distance from main institutions, people can very quickly become disenfranchised, feel isolated and unsupported. So we regard that support as absolutely key to our success. So I'm going to stop there because I'm sure that you're all ready for a bit of a break. Nō reira, tēnā koutou katoa.